So we can start.
Okay.
Leave the follow-up email to the people and then join.
Right. Okay, then. Greetings and welcome to all. Today I will be presenting largely, but we also have available with us today Nicholas Tavanutti, who will also be speaking a little bit and helping me with the Q&A session. So particularly for any Francophone staff, Nicholas will be taking a large part in the Francophone courses in the future. Can I ask everyone to mute, please? Can you please go to mute? Good, thank you. Okay, so today's session around COVID and the public health response to COVID. So our usual housekeeping announcements, please turn off your mic and your video until we come to the Q&A session. You can ask questions at any time by typing them into the chat box. If you're invited to speak, please unmute and turn your video on. As always, the webinar recordings and the slide deck will be shared with all the participants. So if you're registered, you will receive them. So the main objective in this webinar is to try and summarize the module and to give you a chance to ask questions. So we have 2 Q&A sessions. There should be plenty of time to ask questions. However, getting the right answer often requires asking the right question. So please think a little bit about your questions. Again, you can ask questions at any time by typing them into the chat box, and during the Q&A sessions, you can unmute and talk to ask questions. Our agenda for today is 2 presentations of around 30 minutes, 25 minutes. First presentation and then a Q&A session, second presentation and then a Q&A session. As always, I'll be talking rather fast, but you will get the slide deck and you will get a chance to ask questions. So here we go on the impact of COVID-19 on the public health supply chain. Many of you will have witnessed the impact. You know at first hand what the impact is. So why am I bringing this subject? It's really so that we take stock and we learn to advocate to how to make our system better prepared for the future. And that's really the main message today. Well, okay, Prof, but COVID's over now. We can all forget about it, can't we? Well, throughout our courses, we tried to stress evidence-based. What's the evidence that COVID is over? World Health Organization is not saying COVID is over. 4.5 million new cases during February, March. That's not over. That's still there. It may be less of a problem, but it is not over. Use evidence. Use the WHO epidemiological reports to decide when COVID is over, and it's not over yet. That's the evidence, not what people think, not what people know. What is the evidence for the state of COVID? And if we look at the graphs, we see there was quite a big peak in December, both in cases and in deaths. So that's not over when you're getting peaks like that. Again, from WHO website on the status of COVID during March. And if we look at the map on the dashboard here of what about the vaccinations? Less than 20%, the orange and red areas. Well, the red area there for Yemen, at the bottom of the Arabian Peninsula, there's a major conflict going on there, you might expect it. But all those orange areas in Africa, that's not a very high vaccination rate. So countries are still not very well prepared if another wave of COVID came along. They're not prepared for it because vaccination levels are still low in some countries. And we can see that last year in December, there was a sudden surge in the Pacific. Well, what's that got to do with me? We don't live in the Pacific. Point about COVID is that no one is safe till everyone is safe. None of you on this webinar lived in China, and yet COVID came to your country. The whole world is affected. If there's a resurgence anywhere in the world, it's going to come to you. It's going to affect your country. So we have to be aware of what is happening around the world. Not just saying, oh, it's not a problem anymore. Yes, it still is a problem if surges or pandemic breakouts are still occurring. And if we look at the map of COVID cases, where is it increasing? Well, there's quite a few countries in Africa there, the orange and the red, where it's increasing, the whole of Russia, other areas as well, where it's still increasing. It might be declining in your country, but in other countries it's increasing, which means pretty soon it's going to come to you again. Use the evidence, not what people say around you, oh, it's over, it's finished. No, it isn't. Use the evidence to determine what the state of COVID is. And we look at the change over the last 28 days, just the beginning of March, we again see orange and red. That's the deaths. People are still dying from COVID now, today. They're not over when people are dying. I don't want to sound too pessimistic. What I'm saying is be a realist. Don't assume that the pandemic is over because it's less now than it was. Look at the global figures, monitor the global figures, and then make an informed decision. So what's my point from this? Is use real evidence to decide when COVID is over, not opinions. Up on the right of the screen, you can see the pie chart there, which is what's the opinion that COVID is over. We're not interested in opinions. We want to know what is the evidence. Use evidence to decide. WHO says it remains a global emergency. And that means we have to be prepared. And the point around this is quite easy to forget the difficulties that we've been through. And the biggest fear I have is that COVID will be forgotten. Everyone's saying they're back to normal. My message is there is no normal anymore. The new normal is different to how it was before COVID. We're in a different equilibrium now. People are already dismissing COVID and saying, oh, we can forget about it now, it's finished. We just get back to normal. There is no normal. It's now a new normal, a different operating environment because of COVID. COVID wasn't the cause of many of the problems. It was a trigger to show how bad, how poorly operated our supply chains were. But again, people are saying, well, 3 years on, ocean freight times are getting back to normal, stocks are moving, shipments are happening. China's lifted its zero COVID policy, materials are flowing again out of China, and we don't have to worry anymore. That's a false message. The system was broken by COVID, and it might be glued back together, but it's still been badly broken, and it's still not operating that well. We need to take that into account. Lead times are still longer. Shortages are still present. There is a management term called black swan. This refers to a very rare and unlikely event that perhaps happens only once in 100 years. And many people are now trying to dismiss COVID as a black swan. Oh, it's only once in 100 years. Can't be expected to plan for that. And that gets it entirely wrong. And we have to fight against this message. Even if COVID was a black swan, our supply chains were already far too weak, far too reliant on single sources of supply, far too reliant on imported items with exceedingly long geographical supply chains and long lead times. Too little buffer stock, no strategic stocks, no pandemic preparedness. In short, our supply chain was not resilient. COVID didn't cause those problems. Those problems were already there in the supply chain. COVID just highlighted how poor our supply chain was. The message there is we needed major reform long before COVID hit. But now, as we look at post-COVID, we need it even more. And we must dismiss this idea of black swan. So this idea of black swan is that you can't do anything about it. It's totally unpredictable. And it wasn't. It was predictable. Way back 10 years ago, WHO tried to get countries to prepare a pandemic plan. 92 countries prepared one. Only 4 ever implemented it. We should have been prepared. We should have been ready for COVID. We can prepare. We can get ready for COVID. There are 3 criteria to declare a black swan event. Is COVID an outlier? No. Before COVID, we had SARS, we had MERS, we've had Ebola, we've had avian influenza. All of them were warnings. Even Bill Gates in 2018 said there's going to be a pandemic. He's not a medical expert. It didn't need a medical expert to predict what was going to happen. Second criteria, does COVID carry an extreme impact? Yes. And that impact could be predicted, and it was predicted by many parties. Are people trying to normalize it and forget about it? Yes. People are already trying to say, well, we couldn't have done anything about it. It was totally unpredictable. Nothing can happen. Again, totally wrong. We have to fight against these kind of ideas coming forward. So COVID is not a black swan event, but it does bring lots of warnings. The point about COVID is to learn from it. Learn what happened. Learn how to be prepared for pandemics in the future, because it is certain that more pandemics will come. They may not be as severe as COVID, they may not be as prolonged, but they will become common, and we have to be ready for them. Well, was COVID really a public health crisis? Was PSM really in crisis? Yes, you were there, you were handling the stuff. You couldn't get enough test kits. We couldn't get enough PPE. Look at the impact. COVID doesn't affect pregnancy, but we had more than 1.4 million unintended pregnancies because people could not get family planning supplies. COVID disrupted the supply chain. How many excess deaths from malaria did we have? COVID doesn't cause malaria, but people were dying because we could not get anti-malarial medicines to them. Understand the massive disruption that COVID had on the supply chain. You were there. You can remember it, and we have to advocate and make sure it's not forgotten and that we become better prepared. Was it really that serious? Well, yes, it was. Not only did it disrupt everything and the whole supply chain, it brought a lack of trust and pressures between different stakeholders who were all blaming each other for all the problems. We have to try and understand and work together during a pandemic. We can see 10% said their organization had no planning. Nearly 50% said they had some planning, but it clearly wasn't enough. 17% said they were fully prepared, but frankly, there's little evidence that they were. So what needs to happen? What can we do about it to get better prepared for the future? And it starts with having a risk management approach. And that needs PSM staff who are trained in risk management. You need to focus on the strengths of the supply chain. There was buffer stocks and UN agencies and global agencies trying to support people. They had some buffer stocks available. We need to plan better and make better use of them. We need to stop disruptive partnerships. Stop arguing amongst the partners. Often we're in a fight with the Ministry of Finance nearly all the time. We have to try and find ways to work together better. Keep up with the innovations. Know what treatment and diagnostics are needed and try to keep on top of what's happening. Accelerate the procurement and supply process. We don't have reliable data in many of our supply chains. We don't know what we've got and where it is. We must improve the data. We look at the PSM crisis, and what did we have? We needed risk management. We've got virtually no staff in the public sector who were trained in risk management. You are different. You have the risk management module as part of this course. Strengths, most countries had at least 3 months buffer stock. That at least gave them a little bit of breathing space when COVID hit. We've got these disruptive partnerships. We're often in conflict with the Ministry of Finance, with importers, with national suppliers, with some other NGOs. The different vertical programs are arguing among themselves. We have to try and work together better. Innovations. Many countries didn't know what information was available from WHO. Many countries didn't know about the essential supplies forecasting tool, how to calculate how much and what you need, how to get all the specifications. WHO produced them, countries didn't know about it. We have to try and be better informed on what's happening. And we need much better data information from PSM systems. We've still got a mixture of manual and really quite basic computer systems. Often the information we've got is unreliable. We have to get a lot better at collecting real data. How did we get in this situation of being such a poor operation for supply chain? Part of it is there's been too much focus on efficiency. We've had a lot of cost cutting without understanding the impact on the resilience of the supply chain. In general, as we increase the efficiency, we reduce the resilience. For the past 10 years, it's been all cost cutting. Many of you will know that from personal experience. People have not considered the impact on the resilience. They've only considered the short-term cost. So generally, as we increase efficiency, we reduce the resilience. Conversely, as we increase resilience, we reduce the efficiency. And we have to try and find a balance between the two. Too much of either one is not good for our system. We have to bring the system into balance. And that's the key message around efficiency and resilience. The last 10 years has been all about efficiency. We have to change that and bring resilience. But we must not go completely 100% resilience and forget efficiency. We need to increase resilience, but bring it back into balance. So this balance is really the key point. Right now, we're getting a lot of clamor, a lot of people saying we must go for resilience. Yes, we must, but we must not go overboard. We must not go too far down the road of resilience. Otherwise, we're going to lose all the efficiency gains. We have to become more resilient, but in a balanced way. So if we look at our classic approach, what we want is fast, cheap, and good. And you can never achieve that. You can only ever get 2 out of 3. You can get fast and cheap, or you can get good and fast, but you can never get all 3. And in a way, we don't need all 3. We're allowing emotion to cloud our judgment. That might be what we want. It's not what we need. We don't actually need fast. What we need is reliable delivery times. If we know what the delivery time is, it doesn't matter if it's 3 months or 6 months, provided it's reliable. So what we need on the balanced approach instead of fast is agile. We can respond to changes in circumstances. We can move quickly to adjust what we require. The same on cheap. We don't actually need cheap. What we want is cost effective, not the lowest commodity price, but the lowest total ownership cost, the total cost of having supplies over the long term. That's cost effective, not cheap. There is a famous Russian proverb, we are too poor to buy cheap medicine. Because if we buy cheap medicine, it won't work, and then we'll have to go and buy expensive medicine again. What we want is cost effective. Good. Again, we don't need good. Brand name products are good. We don't need that. What we need is assured quality. Generic is fine if the quality is assured. So the message is to change our approach from what we say we want to what we need. And what we need is a balanced approach, agile, cost-effective, and assured quality. We can achieve all three if we use a risk management approach. Again, we don't want absolutes, we strive for a balance. We need to bring a balance to the operation. So what was the impact of COVID on our supply chain preparedness? Well, here is central stocks from central medical stores in African countries for HIV, TB, and malaria. COVID doesn't affect those diseases, so why are we risking being out of stock? Because COVID has disrupted the whole of the supply chain. The whole global supply chain has been broken. It's starting to come back, but it's still not strong. We also had to cope with the sheer volume of products for COVID, massive amounts of PPE, physically huge volumes. But our overall problems were a poor performance, we had no resilience, and we had no pandemic preparedness, and we should have had all three. Even if we look at the targets for 2023, it is that only 15% stockouts of antiretrovirals in 2023. That's a very depressing target. Only 15%. That's the target to try and reach. I do hope we can do a lot better than that and get far fewer stockouts. But that's the impact that COVID has had on totally unrelated products in our health supply chain. Well, why weren't our supply chains resilient? Because we had this lack of balance. Also, many of our procurement systems are archaic. They came in many countries from colonial times, and though themselves came from the military, they weren't any good 50 years ago, and they're certainly not any good now. We have to get much, much better procurement systems. And this might sound like I'm attacking the tender system. I'm not. It's not the theory of tender system that's at fault. It's the way it is implemented that is at fault. And that really has to change and become far more focused on resilience and far more flexible and agile. And there are many ways to achieve that if we use a risk management approach. We also became dependent on very few sources of raw materials. Many of you have heard my webinars before. You know that I've talked about Wuhan. Well, I'm sure before 2019, none of you had ever even heard of Wuhan. Now everyone knows it as the place where COVID was first identified. But it's also the place where the majority of API is manufactured in China. And people don't realize, or didn't realize, that although they buy most of their medicines from India, India gets the API, the active pharmaceutical ingredient, from China. So when China's in lockdown, India can't manufacture the pharmaceutical products. We've relied too much on single source, but it's not just medicines. For sterile gloves, latex gloves, all the rubber is bought from Malaysia. Why? Malaysia is not the only country in the world that grows rubber trees. Why is it all being bought from Malaysia? Because that's the effect of globalization and single sourcing on the supply chain. Because you only buy gloves, you don't buy rubber. Many people don't know about this connection, about this linkage in the international supply chain. It's something now that we have to learn about. We have to know, where does the gloves come from? Not just the country of manufacture, but where do they get the materials from to manufacture them? And build on that to make our supply chains more resilient. We can't just look at the finished product. We have to look at how it comes about. So we've got this great big clamour, lots and lots of papers have published, ministers and other people talking that we must be more resilient. And that's great. But I actually see very little happening to make public health supply chains more resilient. The archaic procurement methods have not been replaced. If we look at the example given here from Senegal, they said that they can produce, they can manufacture in Senegal. They're right. But it's going to cost 25% more. The minute it's going to cost more, suddenly resilience disappears and we're back to just efficiency, cost saving. We have to understand resilience comes at a price. And that's the point of balance, balancing efficiency and resilience. We're going to have to pay more for resilience, but we balance the amount we have to pay. Sources of supply, they're not being diversified. People are still buying from the same sources they bought before COVID. Emergency pandemic stockpiles are not being created. They're not being built up. None of the things that are going to give us resilience that everyone's talking about are actually happening. And we have the International Red Cross warning us that if we don't take action, if we don't learn from COVID, then we're going to have the whole situation repeat again. We have to learn from this. We have to implement. That means that you have to be able to advocate for the supply chain system for it to become more resilient. Okay, just on time, here's our first Q&A session. Do we have anything in the chat box? Share the PowerPoint with us. Yes, all of our webinars, they get it shared with you. Everyone, you get the recording on Facebook and you get all the slide deck as well. If anyone has a question, please raise your hand and we'll try and come to you. Please raise your hand and we'll ask you to unmute and ask the question. Everyone overawed. Everyone overawed. Patrick, go ahead, please. Unmute and ask your question. Yeah, go ahead, Patrick.
Yeah, thank you so much, Prof. My question basically is on diversification of sources of active pharmaceutical ingredients. Are you getting me?
Yes, go ahead. We can hear you.
Okay, thank you. Yeah, so looking at COVID-19, I think this is one of the approaches which we can use globally to at least build a resilient supply chain system. So I wanted to ask, what can we do as supply chain professionals? What is our role in terms of getting to such a level whereby we have diverse sources of active pharmaceutical ingredients? What should we do? What can we do as supply chain professionals with respect to diversification of sources of active pharmaceutical ingredients? Thank you.
Okay, I'll start the answer and then I'll ask Nicholas to add to it. Okay. When you make the tender, you ask the supplier to state the country of manufacture. You could also ask the supplier to state the country of the API. Then you would know. So if you're comparing different ones, you could mix and match. You could go to 2 different sources then. If every manufacturer that you've got has the API from China, you're in trouble. But chances are there'll be at least one alternative. So ask for the information, then you can make a decision. Nicholas, can you perhaps add to that? You have experience of multiple sourcing.
Yes, in fact, the problem of multiple sources is about the donors. You know, the donors, every time they ask you for efficiency, they ask you to select only one company with a very good price. So it's very complicated for the donors to understand this kind of point. So I think the first thing as a PSM expert or PSM responsible is to discuss with your superior, your boss, your donors, and explain the situation. That's mean right now, I think we get back to the same issue than before the COVID. That's been nothing changed a lot. So that's mean advocacy is very important. Now we have really to discuss with the finance people, M&E people, human resource people, the donors and everyone for them to understand what we should do. That's mean we have to change our way of procurement. We need to select several suppliers rather than only one. So we really need to change our perspective, and for that you need advocacy. You really need to discuss and to impose yourself in the discussion and say, okay, guys, after the COVID, what's happened? We really need to change our way of work. So that's the first point. I think talking with the people, talking with your responsible, and really explain by statistics, but what the professor explained to you, what we should do. That means this kind of balance, become much more resilient. And you know, the donors, when you speak with the donors and say, okay, we need more buffer stock, we need to buy more buffer stock, they will say, that's very expensive, that's very dangerous. So you need to explain by A plus B, what does it mean, and what will be the benefit having, for example, much more buffer stock. I don't know what you think, Andy, about that.
Excellent, exactly right. Very well put, very critical point about the donors. Okay, Modeste, please unmute and ask your question.
Yes, thank you. Hello, are you hearing me?
Yes, we can hear you. Go ahead.
Okay, thank you very much, Prof. Andy and colleagues. My question is, we are talking here about emergency, future emergencies, knowing that resilience is something that is very important, and it's about navigating through hard times, challenges, etc. But in terms of supply chain, we really talk about agility in terms of emergency, when it's about emergency. And we know that most emergencies, sometimes they are very different. This involves having new products, new specifications that should be customized to the need from the field. So how can we, as a supply chain people, ensure that we have an agile supply chain that is able to cover different emergency situations, and knowing that most of the time it's not that we already have stock, buffer stock that are in place, because sometimes it involves product development, for example, when there are some critical items that are needed for emergency response. So my question is actually to see how, as supply chain, we can cope in such situations. Yeah, thank you very much.
Okay, that's quite a lot. Okay, first, new products is being aware of the innovations. WHO publishes regular bulletins, regular information. The procurement team has to get used to accessing that and being aware of it. During COVID, we had the emergency supply forecasting tool. 50% of countries didn't know about it and weren't using it. We had to advocate and press that out. You have to be aware of the innovations and what's happening. Many short webinars, many short videos available on COVID from different agencies on the innovations, on what you need and how to calculate how much you need. How do you become agile? It means a change of mindset. It means moving away from the rigid procedures that we've had for 50 years to recognize the modern status of the market and how you respond to that. We must maintain full financial probity, but we don't have to have these procedures that lock us in. Again, I'll ask Nicholas, please, to add to that and bring a different perspective.
No, the perspective is more or less the same, but I would like that people understand we need to move away from emergency and go to planning. The problem is in many countries, we are talking about emergency rather than planning. I think we are clever enough to plan something rather than every time to say emergency. And most of the time when you audit some company or some organization, you see that there was a lack of planning. And because of the lack of planning, they use the word emergency. So we have to be much more flexible in that and going to more planning rather than emergency.
Yep, excellent point. We should be there. We should be ready for the situation. We should have that in place. Okay, we have any more questions? I don't see any hands, and there's, okay. We have nothing in the chat box. Okay, then I'll continue to round 2 and we'll have a longer Q&A session after this second round of presentations. Well, if we just look at what is the industrial, what's the private sector response to this supply chain situation? And that is to move from the just-in-time approach to the just-in-case approach. Now, in many ways, you've been doing that already. You already keep buffer stock, and that's a just-in-case situation. But it's moving towards that, and it's making our suppliers understand the need to that. So whilst we in the public sector may have been holding buffer stock, the wholesalers and the suppliers who supply to us have not. They've been on the just-in-time, not the just-in-case scenario. So we have to encourage them to move towards the just-in-case, to them holding some buffer stock as well. And that means supply chains that are closer to home, investing more in technologies. For example, before the pandemic, 50% of companies didn't even know all their locations. Moving from just-in-time to a just-in-case scenario. Know who is supplying you, where they are supplying from, and where they get their raw materials from. Encourage the industry, encourage your suppliers to move to a just-in-case situation, away from the just-in-time. What can you do? We start with advocacy. And we start with a lot of stops, I'm afraid. Stop dismissing COVID as a black swan that will never happen for another 100 years. It won't be another 100 years before another epidemic comes. Fight against that kind of statement. Stop this nonsense that we could never have been prepared. We should have been prepared. WHO tried to get us prepared on the influenza and avian influenza pandemic preparedness plans. It supported every country to make and write a pandemic preparedness plan. 92 countries did, only 4 actually implemented it. We should have been prepared, should have been ready. Stop this nonsense. We can't afford to be prepared. It's exactly the opposite. You cannot afford not to be prepared. How much has COVID cost us? How many lost lives? How much disruption? Not from the COVID infection, but from the disruption to the supply chain caused by COVID. How many extra malaria deaths? How many extra newborn deaths? Because the supply chain was disrupted and they could not receive essential medicines. That's the cost. We can afford to be prepared, and we must afford. So we have to be able to advocate. And there's lots of material to support how to advocate, the Smart Advocacy Programme and the IAPHL, how to spread the knowledge about the supply chain. Be prepared to advocate. You have the knowledge. You have to be able to use it to try and lever improvements in the supply chain. Advocate that COVID is not a black swan. Even Bill Gates predicted it in 2018. He's not a medical expert. If he can predict it, then we should have been ready. So let's get ready. Let's move away from this black swan, throw that out completely, and understand we must be better prepared. We can be better prepared. It is possible to prepare. We had the influenza pandemic preparedness plan from WHO. Lots of countries wrote it. Lots of countries did it. But no country was too prepared. Said only 4 countries actually implemented the plan. Thailand was one of them, where I am based, and they were able to get off to a good start on pandemic preparedness for COVID. Unfortunately, in the PSM plans for pandemic, in the plans for pandemic preparedness, PSM elements are often missing. So even when people write a pandemic plan, it's often just clinically focused. They don't think about PSM. They don't think about where the commodities are going to come from, or who's going to pay for them, and how much storage space you need. We have to advocate not just for pandemic planning, but for PSM to be an integral and major part of pandemic planning. We have to force countries, as they start their pandemic planning, to include PSM. There are lots of pandemic plans around. Some of them are good. None of them have PSM elements. This is a result of a survey we did in Southeast Asia during COVID. 5 countries. Did they have pandemic planning? Yes, they all had pandemic plans. Did they have any PSM in the plan? Well, 1 country had a bit, but 4 of them had nothing. So they'd written a pandemic plan with no idea how they're ever going to get the commodities. And that's typical of what happens. Even when there is pandemic planning, PSM is not included, and we have to try and bring that forward. We have to try and bring that measure into country pandemic planning. I talked about the cost. What's the cost of a supply chain failure? Here's an example from the Philippines. They were out of stock of TB medicines for a little more than a month. Well, okay, it's first-line TB kits. Many of you are familiar with that. So the impact of that stockouts is that 266 patients who had interrupted treatment because they couldn't get their TB medicines now developed MDR-TB. But they didn't just develop MDR-TB, they went on to infect other people with MDR-TB. And those people went on to infect other people. And all in all, 588 patients died. Out of stock for 1 month, nearly 600 people died. But now I've got to treat all the people who've got MDR-TB. And you know MDR-TB costs a lot more. A TB kit is about $35. An MDR-TB kit is about $2,500. And the total cost of that stockout is estimated to be $21 million. That's the cost of the stockout. $8,000 per patient who had interrupted treatment. The TB kit is $35. It cost me $8,000 per patient for being out of stock. That's the kind of cost calculation we have to try and bring to people to help them understand what we mean by the cost of resilience and why it's worth paying. Being out of stock costs money. Having a non-resilient supply chain costs money and lives. In order to try and measure this, we have a system called QALYs and DALYs, quality adjusted life years or disability adjusted life years. Two systems are a little bit different, but they try to measure various aspects of the cost impact of treatments. So if we use that calculation, the World Bank came up with, for antiretroviral therapy for HIV/AIDS, that's using ARVs, the cost is about $350 per patient year. The cost of not treating a patient, of not having ARVs, of being out of stock of ARVs, and the patient dying is $28,000. Which is most cost effective? To have some buffer stock or to pay $28,000 per patient because you were out of stock? That's the kind of cost-effective calculation we need to make. Now, QALYs and DALYs are complicated. We don't need to know too much about them other than it's a method of doing the calculations. We can just take the outcome, $350 versus $28,000. That's the kind of cost calculation we have to show to advocate for paying for resilience. So this is a ratio of more than 200 to 1. That would mean even if I ordered 200 patient years, about 3,000 bottles of ARVs, and they all expired because I ordered too much, that's still cheaper than being out of stock. That's the risk calculation. That's why we use a risk management approach to get the balance between the two. I could have 3,000 bottles go out of stock and it's still cheaper than denying one patient treatment. That's the kind of message we have to get through to ministers and the Ministry of Finance and everyone else involved in administering the procurement supply chain. Medicines save lives. Having stock, being resilient, saves lives, and it is cost effective on a ratio of 200 to 1. Well, that's all very good, but how do we actually go about getting this resilience? We need advocacy, and we start by this fallacy, this false understanding of cost efficiency and failure to adequately fund supply chain operations. Recognize the true cost of death from supply chain disruptions, and stockouts cost lives. Use a risk management approach. That's the key to building resilience, a risk management approach, and implement resilience measures. Often we get a risk management approach, we see what's got to be done, and we never do it. We have to follow through. Understand what is the cost of a stockout on a life-saving medicine like ARVs. For the private sector, that's easy, it's a lost sale. For the public sector, it's denial of treatment, pain, increased morbidity, increased mortality, alienation of the staff, they're not happy because they can't treat patients. And we put a cost on all of that using this QALY-DALY system. So risk management and understanding the true cost of resilience and stockouts. So how do we go about this risk management? There are excellent guidance documents there on the screen on the previous slide and this slide with the links there. Start with a clear idea of what you want to achieve. That is, you've got a policy, a risk management policy. You're going to proactively manage risks. You're not going to wait till a disaster happens to start planning. Start planning before it happens. Use a risk management approach, not just for emergencies, but for all your PSM operations all the way through. Prepare greater resilience. Be ready for supply chain disruptions. Be ready for pandemic and disasters. Insist, force your way into national pandemic planning so that PSM has a voice, has an understanding. You can't have a pandemic plan without commodities. You can't practice modern medicine without medicines. And that means there has to be a PSM plan. Improve confidence in the ability. Right now, our supply chains are really weak and everyone knows they're weak. But with risk management, we can improve them and we can improve our profile, even in disrupted situations. So what do we have to do? Change the way we do procurement. And that sounds like I'm against tenders. I'm not against tenders. I'm against the way we do tenders. Understand the risk of a supplier default. Understand the fragility of the global supply chain. Some farmer in Malaysia is growing rubber trees and it's sent down and it's exported and it's made into globes in China and they're packed in India in talc and they're sterilized probably in a different country again and then sent to your country. It's a massive, long geographical supply chain. Understand the fragility and the risks. Change the way we do storage and inventory management. We need much better storage conditions because we're going to have increased buffer stock. We can't have poor storage when we're holding more stock. Balance buffer stock with expiry date risks. People are far too afraid of expiry. Understand we should have some expiry, not very much. We keep it very low, but we should have some expiry. Otherwise, we're not keeping enough stock. Change the way distribution and delivery to site is managed. Do all of this in a balanced way. Well, what's the practicality of this on procurement? Right now, it's winner gets all on the tenders, but I could split the awards. So instead of winner gets all, I choose 2 suppliers for each critical item, and I might split it 80-20. So the lowest tender gets 80%, the second lowest tender gets 20%. And South Africa and all the UN agencies have been doing that for years, but it's not very widespread. But understand, there is a cost. These are real figures on the screen. They're actually from Uganda. So if we look at it, the lowest price, we give it a score of 100% on the tender. And the second lowest price was quite a lot higher. It was 160%. So if I did an 80-20 split, I give 80% to the first supplier, lowest price, and 20% to the second lowest price, it would cost me 11.9%, let's say 12% more. The cost of resilience is 12% more because I've split the award to 2 different suppliers. That's the kind of cost I have to look at. Is that cost effective? Well, what's the cost of a stock out? To answer that question, I need to know what's the risk of a stock out. And I do that using risk management. I know what the cost of a stock out on TB drugs is. It's $21 million. That would make it very cost effective to have the 80-20 split. But I can use a risk management approach to decide. I don't have to do split awards on every item. No one is going to die from indigestion. If you're out of stock of antacids, tough. It's not a critical item. But on the Venn system, which I know you're all familiar with, I could at least look at the vital items for doing split tender awards. At least there, the life-saving medicines, the vital items, I could look at improving resilience there by doing split tender awards. That's a practical example. Right now, there's a big clamour to move from international suppliers to local manufacture and local suppliers. And there's some merit in that. I want to sound a few words of caution. Understand that modern pharmaceutical manufacturing is not really manufacturing. It's more like assembly. And I say that because typically the active pharmaceutical ingredient is purchased internationally. And most of it's purchased from China. And the excipients that you mix in with the capsule or the tablet, everything from rice starch to titanium oxide to beeswax, where do you get that from? Oh, we get it from China. And even the gelatin capsules, where do you get that from? Oh, we get it from China. So if my local manufacturer is going to import everything from China, how is buying from them any more resilient than buying from India? Because they're going to have exactly the same supply problems as everyone in India. Now, I'm not against local manufacturer. It can have a real role to play. What I'm saying is be realistic. Is it really more resilient to go to local manufacturing? In some cases it is, but you need to undertake the analysis. How are they making it? Where are the raw materials coming from? And is that really going to be more resilient? And we can look at the same situation on PPE, personal protective equipment. Many countries are saying, well, we can sew up the material, and yes, you can. Where do you buy the fabric from? Oh, guess what? We buy it from China. Where do you buy the thread to do the sewing from? Oh, we buy it from China. How is this any more resilient than buying the garments from China or another country which is buying the materials from China? Yes, local manufacturing can help, can assist, but it needs a proper analysis. Is it really more resilient? Also, it's not easy to put together. A lot of them have quite complex specifications. It's not just a simple sewing job. You need to put a lot of layers together, a lot of materials together in a mask. Understand the complexity of what appears to be a simple item like a face mask. There's lots of problems on local manufacturing, which I'm sure all the local manufacturers will tell you. There's a lack of capital investment. It's hard to get quality and standards enforced. There's weak enabling frameworks. It's generally very small markets. The population of India is 1 billion. Their domestic market is 5 times larger than the largest country in Africa, Nigeria. Yeah? 5 times larger. Your markets are minute in comparison. There's often poor infrastructure for delivery to get items through. So there's lots of problems. I can support local manufacturing. It has a real role, but we must look at it carefully and see if it really is improving resilience. So analyze correctly, make sure it is really contributing. Carefully assess the practicalities in your environment and the infrastructure that's available. It can help, but only with proper resilience planning. So I'm just on time. My summary now is public health supply chains were already weak before COVID hit. COVID is not a black swan event. Rule it out. Advocate against dismissing it. Learn from it. We have to get back to a balance between efficiency and resilience, using a risk management approach. Preparing the future needs massive changes if we're going to get resilience and if we're going to be ready for the next pandemic. Your role is to help to advocate for that. Okay, we're back to the next Q&A session. Okay. Oh, quite a lot in the chat box. Let's have a look there, what we have got in the chat box. Okay, let's look at these questions first. COVID-19 came at the front of everyone, even for big organizations with strategic plans in place. Well, I'll ask Nicholas to relate to us his experience of some companies who did very well in COVID.
Well, let's say that some organization did very well in COVID because we have the money for that. And when you have the money, I mean, you can do let's say, miracles, you know. So the problem is with the money, you can buy everything you want. But during COVID-19, it was very complicated, especially for small things like all the small plastic you need for the test, or all the plastic you need for the reagents and etc. So it was very, very complicated. Something you could get in, let's say, 1 month before the COVID, it takes 9 months to get. So it was very, very, very complicated. And during the COVID-19, you need to be extremely proactive person. If you are not proactive, you achieve absolutely nothing. So even the big organization, even having a lot of money, like for example, the United Nations, even having that, you know, the market is the market. You cannot get what you want, even with the money you have. For example, at the very beginning, we wanted mask N95. It was impossible to get that because the USA didn't want to export their mask to Asia. And the only way was to get masks from China. And China, they start to say, okay, you want masks, we're gonna produce masks. So what they did, China, is to build an entire factory manufacturing only masks for us. Can you imagine that? They did that in 2 months. It was incredible. So what I said, everyone ready for the COVID with a lot of money, yeah, but you need a lot of connection as well. So, you know, you didn't have time to have a strategic plan. It was an emergency situation, and you have to be very reactive and proactive during that time. So I don't know what to say about this COVID-19. It was a very big experience, but very complicated anyway.
Okay, we'll come back to that again in a minute. Okay, from Emmanuel, I agree with you that we have to move away from emergency to planning. But how do you plan when the resources do not exist? The same way that you do anything else in our world, you have to ask for donor assistance. Right now, countries are not asking for donor assistance. They didn't want donor assistance. They didn't want to undertake pandemic planning for influenza and for avian influenza. They were pushed into it by WHO, and they were funded by WHO to do it. We start by, if we don't have the resources, accept we don't have the resources and ask for them. Right now, countries are not asking for it. They're not asking for PSM strengthening. We look at Global Fund grant applications, less than 10% are asking for PSM strengthening. We have to advocate and ask for it. I know it's very difficult, it's not easy, but that's the challenges that we have. Okay, let's move on down to the next one here. It took months and years to have products and vaccines for fairly everyone, although existent. Yes, it did. There wasn't a lot of political will for sharing, was there? How can we get around that? By being better planned. Again, better planning. The whole COVID vaccine was a fiasco, was very poorly operated. We need to learn from that and be better prepared. But again, for WHO influenza planning 10 years ago, countries were offered cold store strengthening, cold chain strength, didn't want it, not interested in pandemic planning. Have we learned from COVID? Are we interested now to be ready to receive vaccines, to have a supply chain ready to move them? I don't see much happening yet. We need to advocate for that. Recognizing the shortcomings of the preparedness for and response to the COVID-19 pandemic, WHO recently created the Global Pandemic Supply Chain and Logistics Network. Any thoughts on such initiatives and how it could benefit low and medium countries? Perhaps, Nicholas, you have experience there with Global Fund operations alongside UN ones.
Yes, but my experience with a Global Fund was a long time ago, let's say, and I didn't work with them for the COVID-19. So my experience is very limited regarding the COVID-19. So maybe as you were working with WHO and developed quite a
Right.
few things. You may talk about
Okay,
that.
then I'll take that one then. Right. Yes, Global Fund put forward that, and it's got a supply mechanism now also available for COVID products. It came a little bit late to the party, but it moved off very well, and that's good and operational. And we can support that. And yes, that can be there. But again, people are not asking for PSM strengthening. How are you going to be better prepared if you don't strengthen your operation, if you don't get the resources to undertake the planning and strengthening? So we're seeing WHO has created this pandemic supply chain, very good technique, got in the products, a little bit slow on delivery, but coming through reliably. That's good news, but ask in the Global Fund grants for the resources to undertake planning.
Yes, if I may add, Andy, about that, that's true in many countries. Every time there is a lack of PSM strengthening in the budget. I mean, I'm not sure that let's say the PSM experts they scared to discuss with their supervisor about strengthening the PSM or having additional staff, because it's costly, and most of the time you have a negative answer from the donors. So I think all the slides you share today are very important for the PSM expert or PSM responsible or managers, just to collect these slides, to check again, to understand these slides, and really advocacy should be the priority in the future. That's mean, thanks to that, they need to discuss to their supervisor, to the donors, and say, okay, guys, now we need to move, and maybe we need to have more staff, more competent staff, to have more training, international training, maybe national training, online training, or whatever, but to push on that direction is very, very important, because if we don't do that right now, I mean, the next strike will be terrible for all of us.
Thank you, that was excellent. Okay, from Roseanne Saint-Rose. What type of incentives can be offered to suppliers to hold more stock, given that it is associated with an increased holding stock? I can give you two examples. One is from Indonesia, where the government pays the supplier to hold stock. It pays a fee for holding it. Also in Afghanistan, local suppliers were on occasion paid a fee to hold stock. So mechanisms can be there, can be possible to do that, but it requires a commitment to fund and to monitor rigorously. You have to make sure the suppliers are really doing it, and that means regular warehouse inspections to check their stock levels. It can be done, it has been done. Okay, I'll move down a little bit because we're getting a bit short on time now. Most suppliers rely most on the partnership and contracts to hold stock. Yes, if we had longer term contracts with suppliers, they'd be more inclined to hold stocks. It's a valid point. Are annual tenders really beneficial to us? It's part of the risk management. It's part of examining the procurement routes, making procurement routes agile and flexible, responding to market conditions. Again, from Roseanne Saint-Rose, yes, using framework agreements speaks to the point, move away from traditional one-year procurement titles, yes. Okay. Improve local manufacturing by countries without a corresponding effort to develop API locally will not do much good to local supply chain if we're faced with another pandemic. I think we have to be practical here. There are very few API suppliers in the world, and one of the reasons for that is cost competitive. If you're going to make API in a country with a population less than 200 million, I don't see how it can be ever economic. That's the reality. You're probably, for most countries, going to always have to import the API. That's the reality of the situation. Making API in small volumes is just not cost effective. So yes, we do. We'd have to recognize that, Nigeria, with population more than 200 million, that's a possibility. But you can make the API closer to home. It doesn't have to be all around the edge of the world. That is the point. Not that you must have it in your country, but it can be closer. Okay. Donor assistance has its requirements and conditions. Yes, we often talk about the golden rule. What is the golden rule? The one with the gold, they make the rules. Okay. Donor assistance always comes with lots of rules and conditions. No allocation for technical assistance and PSM strengthening. Emphasis is always on health products. Yes, it is. And we have to try and advocate and change our supply systems so that there's a greater understanding of the need for system and staff strengthening. Okay, that's the end of the chat box for now. We're getting a little bit low on time. Nicholas, any words from you before we have to close up?
Well, no, I think that just the people, I mean, all the participants here, they need to push everyone to strengthen the PSM activities in their own site, and for that they really need advocacy. That's all, and it's all the purpose of these slides you propose today. Thank you.
Okay, excellent. Okay, so many thanks to all for being with us today. I hope you enjoyed it. As always, please send us any extra questions and feedback. We always welcome your feedback on how we can make the webinars more interesting and more appropriate for you. I bid you all good morning, good afternoon, good night, wherever you are in the world. Thank you for being with us. My many thanks to Nicholas for joining us today.
Thank you very much.
And providing the commentary. Okay, good night to all.
Thank you very much, Prof.
Thank you. Bye-bye.
Thank you. Bye-bye, everybody.
Thank you. Bye-bye.
Thank you.
I see again, request to share the slides. Yes, if you registered, you will get the slides.
Yes, can I talk to Priya? Oh, she has gone. Prof, how are you?
I'm always busy, thank you.
Yeah, actually,
Priya is there.
I attended the post-diploma supply chain, and I finished everything, but I'm not getting any feedback.
Okay, then.
Then I have to request you to please drop me an email. I'll take a look to your profile and we'll get back to you.
Okay, thank you, Priya.
Yes, you want to have. Thank you, Prof.
Okay, good night to all. Bye.
Thank you, Prof. This is Musa from Lagos.